Is our health correspondent, Nicola Hill. Nicola, thanks for being on the show with us again. What exactly has the study shown?
Well, this study looked at something like 24,500 people in hospitals across England who had died of COVID-19. And it found that just over 7,500 of them had type 2 diabetes and 365 of them had type 1 diabetes. So the conclusion, as you said there, is the fact that a third of the people dying from the coronavirus have diabetes, which is obviously something that's very worrying. Now, people who've got type 2 diabetes often have other underlying health conditions. It's often linked to age. As you get older, you're more at risk of getting this type of diabetes, and obesity and high blood sugar levels, and also if you're from a black and minority ethnic background. And as we've already seen with the people who have done really badly and died from coronavirus, they fit into these groups. And it's worrying because diabetes is on the increase. In fact, it has been called by doctors an epidemic. Here in the UK, there's 4 million people with type 2 diabetes. Worldwide, that's 415 million. 1 in 11 adults have this. So, of course, if they're even more at risk at COVID-19, that is worrying. And I spoke to somebody who has diabetes this morning. Her name is Sarah. Now, she has had diabetes for 20 years, but she does manage it. She keeps her blood sugar levels even, and she doesn't have obesity. In fact, she's a marathon runner. And she told me that, up until now, she hasn't been too worried about COVID-19, despite the fact that she's a primary school teacher and has been in school teaching children of key workers. But this research is raising her anxiety levels, particularly when here in the UK, children are going to go back to school in a couple of weeks. And she told me that a colleague of hers who also has diabetes but is overweight she said her anxiety levels have actually gone through the roof.
And Nicola, what advice is being given to people with diabetes?
Well, Diabetes UK, which is one of the major charities about diabetes here in the UK, I spoke to them this morning, and they said the main thing at the moment people need to do is obviously to take care of their health, to monitor their blood sugar levels, try and keep them even. Now, what's not known is if people with diabetes are more at risk of actually contracting the disease. This research from NHS England was more if you're hospitalised, your outcome is much, much poorer. So what Diabetes UK is saying to people is to social distance, wash their hands, do all the precautions that, we have all been urged to take anyway. But they're saying people with diabetes need to be especially careful. And if you have type 1 diabetes, to monitor your ketone levels. This is an acid that's a byproduct of having diabetes. And if you see those levels going up, then to take care and possibly seek medical help. But the other main advice that's being given as well is to try and lose weight, because obesity is such a major implication in COVID-19. And there were even reports here in the UK that our Prime Minister, who of course was hospitalised when he got coronavirus, he did think that the severity of his disease was due to his weight. So that is one of the main issues that's being told is if, monitor your blood sugar levels, try and keep them even, and if you can, lose weight.
All right, we'll leave it there. Nicola Hill in London, thank you.